Brave. Thank you. All right. Our next patient panelist that's going to speak is Miranda, and she's a post-surgical patient.
Good morning. My name is Miranda, and this is my story with hypoPARA. When I was 12 years old, my life changed forever. My mom took me to the pediatrician for a lump on my neck. The lump was large, and so the pediatrician referred us to a pediatric surgeon who stated I had a goiter that needed removal. The pediatric surgeon did not discuss the risk of something like hypoPARA happening to me. I was quickly booked for surgery to remove the goiter and half my thyroid. No ultrasound, no biopsy, no further testing was completed. I remember feeling very anxious and very scared about the surgery. The surgeon called my mom during surgery and gave her 10 seconds to make a potential life-altering decision. The surgeon said the thyroid looked suspicious and recommended a full removal. The surgeon explained it would be riskier to complete a second surgery than to take the whole thyroid that day, and I would simply be on a pill the rest of my life, but would live a normal life. My mom consented. Hours later, I woke from surgery, confused and helpless. My vocal cords had been cut, and I could not speak much. By the end of the night, we quickly noticed something was very wrong. My body felt off, and I was having strange symptoms. My symptoms progressed, and I was moved to the ICU. Nobody seemed to know what was happening to me, and I was terrified. The surgeon did not include in the operative report damage to my parathyroids. I remember this surgeon and endocrinologist fighting and arguing outside of my room and how worried it made me feel. It took weeks to figure out my calcium levels, many infusions, and upwards of 40 to 50 times a day. I was later told a complication occurred, and I now had hypoPARA. The endocrinologist told me I would be okay, but would need to take calcium for the rest of my life. But no one could tell me what my future would hold. I spent the next several years fighting my way through school. I was placed in special education classes due to being unable to read or complete simple math. It was almost like my brain was no longer working after my surgery. I could no longer think, could not retain information, and I struggled to concentrate and hold simple conversations. I was told I was lying and faking it. I was sent to a psychologist who told my mom I was doing it for attention and possibly had PTSD. To cope, I stopped eating and developed an eating disorder. My life felt out of control. The first few years after my surgery, I spent my time going to appointments, lab draws, and had countless hospital stays for infusions. I could no longer dance, play volleyball, sing choir, or hang out with my friends like a normal teenager. My life consisted of around-the-clock calcium monitoring, including middle-of-the-night wake-ups due to muscle cramping, tingling, twitching, and other symptoms. The only option was to take calcitrol and calcium supplements. It took over a year for doctors to figure out my body was not absorbing calcitrol pills, and I was switched to the liquid form that cost upwards of $1,000 a month. My mom would later go on to file bankruptcy due to the medical debt incurred from my hypoPARA. Many school days were spent in the counselor's office crying because I could not function in class or leaving to get labs where I was told to go back to the hospital for more IV infusions. My life was consumed with these blood draws and trying to figure out when and how much calcium to take to stay alive. Currently, there's no way to check calcium except to go to a lab or an ER. I spent the next several years taking life one day at a time, doing my best to try and live while battling a rare invisible health condition. I went on to start college, get married, and have 2 children. My journey to pregnancy and motherhood with hypoPARA was excruciating at times. My hypoPARA affected my labor, stalling my progress 3 times for several hours over the course of 3 days before my daughter was born. After my daughter was born, the OB discharged me even though I told him I was not okay and needed labs. I remember having to leave my daughter with her dad in the hospital room while I walked down to the outpatient lab in my socks to wait for labs. I remember feeling embarrassed and humiliated. While pregnant, I had home infusion and had over 150 IVs placed and daily bags of IV fluids just to make it through. I was forced to work from home in between lab draws, appointments, and infusions. My babies were born with abnormal calcium levels, and the entire time I breastfed, their levels would mimic mine. I spent hours taking my daughter to endocrinology appointments and lab draws, only to be told they did not know why her calcium was fluctuating. I felt angry that hypoPARA was impacting my child now. 6 weeks after giving birth to her, my calcium rose to a critical level, and I was rushed to the hospital after collapsing in the living room. I told my husband I was dying. It took several bags of IV fluids to bring my calcium levels down, and was discharged home only to crash again days later. I later learned that breast milk can impact calcium levels. As emotional as it was, I quit nursing my daughter to hopefully stop the roller coaster of low and high calcium fluctuations. My heart was broken, my body failed me, and I felt like I was failing my daughter. After having my son, I remember trying to go to the lab when my body was crashing and being unable to buckle my kids in and out of their car seats due to tetany in my hands. Unfortunately, I have learned that with hypoPARA, any change you make in life can cause a detrimental effect to your calcium level without you even knowing it. Stress, lack of sleep, exercise, temperature changes, and simply existing can cause these fluctuations. I'm now 31 years old, and for 19 years, I've felt invisible and misunderstood. I constantly have to change plans and miss out on important things. I feel chained to my condition at times, and it keeps me from living the life I want to live. My life has been defined by what others think my condition is, not what it actually is. This condition at times feels invisible, isolating, and like there's no way out. It's impacted my entire life, from relationships to jobs to my children and to my overall health. It's hard to not think about how my life could have been very different if the surgeon and physicians were more educated.
All right, thank you so much, Miranda.